thank you so much for coming. It's been really encouraging, I think, for the steering group, and I hope for each other to see so many scientists together in one room from so many different disciplines, discussing common things that we have to deal with and looking to some of our future aspirations as well. I think particularly having at top and tail the meeting with Joe's view of healthcare science looking into the future, and listening then to Emma, the way she'd actually implemented this at Imperial, gives us great food for thought and real reasons for optimism in terms of our continuing and changing role as healthcare scientists. So the model of care is changing. We know that. We know that from these sort of top level papers which Joe was alluding to. But also it's changing, I think, in our own experience, that the roles we have now will definitely be different in 10 years' time. There's no doubt about it. Where healthcare science is going to play a major part in a way which is not just the technical roles which we have now and the deep scientific roles that we have now, but also a much broader role of actually directly being taking responsibility for, sharing responsibility with senior doctors, senior nurses and so forth. And I think one of the interesting things we can do as a group is actually call from the group in the next meeting some examples where we see that role has already changed and where healthcare scientists have got an extended role to those which more traditionally we would have expected. So we'll bring things to a close just with a plea, as we've had before. Please give us your feedback about your healthcare science network, things which you'd like us to do at the next meetings, things which you found useful in this meeting, other ideas which you have. Please get in touch via Bazit or me or any of the other steering group members to let us know how you'd like to shape this network as we go forward. Thank you all very much for coming.